Here to talk about the ever-changing information when it comes to COVID and how to prevent it is Dr. Abraar Karan. He is an infectious disease specialist with Stanford. Thanks for joining us today.
Thanks for having me.
Let's talk a little bit about the tests because they're the hottest item of 2022 so far. Everybody wanting to know if they caught this over the holiday season. Rapid tests and PCR, what are the differences and when would you want to use either of them?
So the rapid test is an immunoassay that detects viral antigen. And essentially this tells you have active virus in your body. The benefit of that test is that you can get it quickly. You can do it at home. It gives you results very fast. The problem with that test is that even if it's negative, it doesn't mean that you don't have any replicating virus in your body. The PCR test is more sensitive, meaning if that test is negative, you don't have COVID at that time. And you have very little SARS-CoV-2, if any, of the virus in your body. Whereas with the antigen test, if it's negative, but you're having symptoms, you need to repeat that test. So we really advise serial testing, meaning if you've had an exposure, you get tested for a few days thereafter, just to make sure, because the virus builds up over time.
What about false positives with the rapid test? Is that a thing?
You can get false positives when you have high community incidence of the virus. So, there's a lot of viral spread and you're having symptoms, then a positive test is more likely to represent a true result. At a time when you have very low incidence in the community and you are just testing people randomly, you're more likely to get some false positives. And there you get a confirmatory PCR test. But that's really when you have low incidence. When you have a lot of spread, it's more likely that positive is real.
Now, speaking of testing, the CDC recently changing its recommendation for isolation if you do test positive from 10 days to 5 days. And there's been some disagreement about whether or not you should need a test to get out of that isolation period. What are your thoughts on that?
Well, that's a really important question. The CDC did say that they're worried about the workforce, right? Just having way too many people out. We know at most of the big academic medical centers now, we have more cases amongst healthcare workers than at any other time. And most of these people are fully vaccinated. And so the real question is, if you shorten it from 10 days to 5 days, what is the cost of doing that? So the cost is that some people will continue to shed virus after 5 days. And so they can still be contagious to others. But we know that most of the viral spread happens early on. So before you show symptoms or right when you start to get sick. And so, yes, on the tail end, you'll still have some potential for transmission, but it'll be lower. If you have a negative rapid antigen test, that may help you to say it's unlikely that you have a lot of virus, because sometimes when you have a positive test, it can tell you that you still have a lot of virus and you could still be very contagious. And it's important to remember that we're still learning a lot about what the antigen tests mean in terms of Omicron and people who are vaccinated. And if there's any shift in the relationship between positive tests on antigen and infectivity. As you've seen, there's some preliminary data coming out showing that with this variant and with people that are vaccinated, early antigen tests are more likely to be negative than before, meaning you may actually have virus, but your antigen test is negative. You could still be contagious and you have to be careful.
It's just too early. Okay, let's talk a little bit about antibodies. Somebody who has been infected, do they have some sort of immunity at this point?
Yeah, so that immunity is there. You do get a boost in your antibodies, your neutralizing antibodies when you get infected. And then as time passes, we do see waning of that. Similarly, with vaccinations, we see waning over time. And it's obviously not the only thing. Your immune system is not just antibodies. You also have cellular immunity. You have T cells. You have other things that come to help to take care of you when you have an invader like a virus. With that said, we do know that that's why we're boosting, because we've seen that when you get boosted, even against Omicron, you're much less likely to get the virus at all. If you have it, you're less likely to get very sick. If you are someone at high risk of being very sick, you're still less likely to be ventilated or die. And that's what we have to do. We have to keep moving as the virus moves, as the virus mutates. We have to stay toe in toe with it.
So somebody, say, who has been fully vaccinated, who has been boosted, but got one of many breakthrough cases. I know there's going to be a lot of people in that situation now with Omicron running around. Does that person have super immunity? Is this person, cool to walk around and do whatever?
Well, the key is, after you've been infected, you would think the few weeks or months afterwards, you are going to have a stronger immune response. You're less likely to get sick right away. One thing I can say is that even if you've had Delta, because Omicron has so many mutations in certain parts of the virus, you're still likely to get Omicron with so much spread, but it'll most likely be mild. We're seeing a lot of mild cases not requiring hospitalization. Now, when I say mild, that still may be like a bad flu. It's not just like the sniffles per se, but you likely won't need to be hospitalized. And I think that, as many of us have said for the last 2 years, this virus is not going to go away. This is going to be something that sort of comes back and hopefully over time becomes more mild, but we can't say that with certainty. And so we have to just play it by day.
So we know people are going to get breakthrough infections. Are they less infectious to other people than somebody, say, who is not vaccinated?
Yeah, they are less infectious. They shed virus for a less amount of time. Even if at a moment in time they can have a high viral load, it comes down quickly. And that's one of the benefits. So the vaccines don't provide sterilizing immunity. Sterilizing immunity would suggest you don't get infected at all. You can still get infected, but you're much less likely to go transmit it onwards to others, and you're much faster at clearing the virus. And that's important because that means that you're spreading it less, and eventually the epidemic starts to die down.
So I'm just going to put a pointed situation out to you. Say somebody has the super immunity, they're boosted, they're vaxxed, they got an Omicron infection. Are they cool to go see, say, an immunocompromised person or an elderly family member?
Well, in most situations, I would say yes. The only problem is we need to understand to what extent those people are still shedding. What we know from all the previous variants is that after a few days, you're not shedding any virus that can be cultured in the laboratory anymore, meaning it's not live virus. You can't infect others with it. And so I'd feel comfortable with that assessment, yes. What I would say, though, is that I would not use that 5 days to go visit someone that's immunocompromised. I would err on the side of 10 or even 2 weeks after, especially, and that's only if you're immunocompetent. If you're somebody that has immunocompromise, you can also be shedding the virus for 3 weeks or more. That's why in the hospital, we have different isolation criteria for people that are immunocompromised than for people that are immunocompetent.
Okay, that's all really good information. Let's talk a little bit about the new study. Pregnant women, a lot of them hesitant to get a booster, but some new information shows that it's not causing any birth complications.
Yeah, it's a really important study that was published out with CDC. I think this has been a big question on many people's minds. Is it safe if I'm pregnant to get the booster? In fact, what we know from a study in November is that you're actually twice as likely to have a stillbirth if you have COVID when you give birth, versus here we have a study showing that when you're vaccinated, you're no more likely to have small for gestational age or complications. And so it's safe. We encourage it. It's extremely important because not doing so, getting infected actually can increase your chance of having stillbirth, which is a big problem, of course.
All right, Dr. Abraar Karan with Stanford Infectious Disease Specialist. We appreciate your time.
Thanks for having me.